Hello, my name is Skyler Gregory, and I'm an occupational therapy student at Texas Women's University, and this is the first module of my Capstone project, Sensory Processing in Neurodivergent Students. A little introduction to sensory processing. It refers how individuals take in, interpret, and respond to the sensory stimuli around them. This module is specific for neurodivergent individuals, such as those with ADHD and ASD, because they process this information differently. It can affect their learning, social interactions, and daily experiences. To start us off, what sensory experiences do you find overwhelming? If you're not sure what those are, they might look like loud noises, bright lights, or certain textures. To better visualize what sensory processing is and how it affects different people, I'm going to be using the Dunn sensory and processing model. It puts everyone into 4 quadrants based on how they seek or avoid sensory input. The 5 sensory modalities it looks at are visual, auditory, tactile, kinesthetic, or environmental. Sensation seeking is the first quadrant. They have a high threshold for sensations and actively self-regulate. They might seek out bright colors, movement, sounds, and they enjoy a highly engaging environment such as group discussion. A specific example of what a student might look like is those who thrive in interactive lectures, hands-on learning, and prefer dynamic study settings. A challenge for them might be a dull or unstimulating environment. The second quadrant is sensory sensitivity. They have a low threshold for sensations, and they do not actively seek out self-regulation. So they might be easily overwhelmed by sensory input, but do not actively control their environment. This might look like in a student who loves hands-on labs, but requires a quiet environment to avoid distractions. A challenge for them are noisy environments such as a crowded lecture hall or a dorm. The third quadrant is low registration. They have a high threshold for sensations, but again passively self-regulate themselves. They require strong sensory input, but do not actively seek it, and sometimes miss subtle sensory cues. This might look like a student who needs an engaging environment like a busy coffee shop or an interactive classroom to stay alert, but they do not actively seek stimulation. A challenge for them might be traditional lectures because they are too monotonous. And they will not seek out stimulation from those around them, just the environment itself is enough to keep them focused. The last quadrant is sensory avoiding. They have a low sensory threshold and actively seek self-regulation. So they avoid sensory input and prefer structured low stimulation environments. This might look like a student who prefers studying alone, avoids group work, and excels in quiet text-based learning. A challenge for them might be group projects, noisy spaces, or unpredictable environments. Typically, there is a library floor or learning area for these types of students because it is common. Sensory processing impacts students' learning. You can look at it from a student perspective or a professor-educator perspective. You can create personalized learning by finding out which quadrant you fit into and choosing the right study habits, learning environments, and note-taking strategies to align with your strengths. From an instructor's perspective, recognizing and understanding how sensory environments might benefit or hinder their students, and then provide a more inclusive teaching practice, such as including visual aids, auditory elements, and hands-on activities, or reducing these if those are already included. You can also adjust the classroom environment by providing more adaptable, quiet spaces or areas for discussion and visual aids to maximize your students' learning. Another sensory processing area is alexithymia. It's not directly related to Dunn's quadrant, but it goes with it. Alexithymia is the difficulty recognizing and expressing emotions. It's again common in neurodivergent individuals and can impact their learning and social interactions. It affects their ability to regulate their emotions, have social skills, and their coping strategies. Alexithymia affects college students by struggling to express their emotions and cope with stress because they don't recognize the feelings, and it can lead to burnout. Also, social struggles that lead to awkward interactions, difficulty engaging with learning materials that have emotional content, such as literature or history, and they might experience test anxiety and public speaking challenges that present as physical stress symptoms. For general ideas to help students who might be experiencing alexithymia is provide self-awareness practices that teach them about their own emotional processes, such as journaling, therapy, and mindfulness. Stress management techniques, similar to the ones stated before, are deep breathing, progressive muscle relaxation, and mindfulness, which will all be touched on in a following module. Social skills training, such as counseling, can provide emotional intelligence and social communication skills that can improve awareness of their own and others' emotions. And then lastly, a support system with their peers, counseling centers, and mental health services provided at the university. Key takeaways are: figure out which quadrant you think you fit into best on Dunn's sensory model and use it to adjust your learning environment. And then if you suspect you have alexithymia, look into possible strategies that can help you. And then personalized learning environments as a student or professor. Thank you. These are my references.